So although we've touched on this, why get involved? The there is a need, admittedly, that can be divided into a perceived need and a real need. The perceived need is nowhere near up to where the real need is. We know that. Some physicians know that, and a few of our patients know that. You know, we've said this before, that the major problem here is awareness. Just, you know, when we were talking about the dental aspects, the dental sequelae or consequences of a compromised airway are manifold, or just about everything in dentistry is touched one way or another, right from cosmetics, flattening of teeth, bruxism, TMD, broken restorations, fractured teeth. The list goes on, and people are not ignorant anymore. They know what's happening. In the majority of cases, they know what's happening, and they know they don't like it, but they rarely know the root cause of these. So as this increases, as this knowledge, the appreciation of what's really going on increases, that perceived need will start to come closer to the real need. Now, of course, from a medical standpoint, it's very unlikely that it ever will, and it's probably a good thing that it won't, because we wouldn't be able to cope in either medical or the dental profession. We'd simply not be able to cope with the number of people requiring, or requesting, I should say requesting, help in this field. So it puts it into perspective in that there is a real and there is a perceived need, and I think it's important to always stand on one, look at the other, and then change sides, stand on that, and then look back, because the way we see things, the way patients see things, of course, is completely different. And if we're really genuinely trying to provide a service that's in their in their best interest, but by the same token they don't really know why they would do that, then there's going to be a lot of frustration results from, or as a result of this, going to be a lot of frustration. One step beyond that is where we come in as dentists, and so the question is, at what point do we come in? And somebody once told me, from a competition standpoint, admittedly, that it's better to be first than it's better to be better. And whilst I'm not entirely sure that I agree with all of the aspects there, I can see the point, and the point is you don't really want to be the last one on the block. My preferential way of looking at this is, and this is what I always felt when I was in solo general practice, which is when something new comes out, some new innovation, some new technique, you don't necessarily want to be the first one on the block, but you certainly don't want to be the last one on the block. So somewhere in there is a good place to be. And I think we may have addressed this, but there are three other areas, which is these are positive things, but there is also areas of trying to avoid problems. And I'm not just talking medical legally here, but I'm also talking in terms of failure to address things that's otherwise going to break our handiwork, our dentistry. And then one thing that is worth mentioning, and I don't think we've addressed this, is why, the real why. And many people watching this will know about the, I won't say sudden, but it is a word that comes to mind, sudden interest in the word why, the why of what you do. So in other words, what is the true why? Because that's the powerful passion that carries you forward. It's knowing your why. And I'm not going to set myself up as a guru in this, but it's probably a good idea to just revisit that why. Why did you become a dentist? And what is the why that makes you go to the office every day, hopefully with a smile on your face. And another thing that just happens to rhyme with why is ikigai, which I hope all of my Japanese colleagues will forgive the pronunciation of. But really what that is the, I won't say Japanese art, but the philosophy, I suppose is a better way of putting it. Ikigai is the philosophy that provides or allows an understanding of the meaning or reason for life in an individual's in an individual capacity. So in other words, and I will put some things in the reference to this, but it's an interesting it's an interesting way of perceiving your life, and it doesn't actually hurt to revisit this from time to time, although sometimes it does cause a little bit of heartache because you realise that you may have missed the ball a little earlier. But nonetheless, the earlier you visit or revisit this, then that's a good thing. I was very reluctant to mention this, but of course we are, at the time of recording this, we are still in the COVID. I mean, 5 years' time we might still be in it, but we're still in the COVID outbreak, and there's a lot of dentists who either have been somewhat shaken by the required changes, or in some cases the perception of risk that we as healthcare providers take because of our intimacy in terms of physical distance with our patients. And this is true of hygienists as well, with aerosols being still an area of some controversy, put it that way. So here then is the take home here is you would take home to the question, why would you pursue this? And as I say, I know that this is almost part two of the question, but sometimes you have to look at it not as why, but why would you not? And there are several aspects of this where if you don't practice it, you will be at a disadvantage. And then the other side of the coin is, why would you practice this? And in many respects, apart from the reasons we've been through, which are perhaps very practical, from a philosophical reason, apart from the obvious benefit to your patients and society, is the potential benefit for yourself. And I'm not setting myself up, as I say, as a philosopher or psychologist here, but it probably doesn't hurt any of us with to revisit the insight into our lives. And there are lots of, and I will put references to both the understanding and using the why in our lives to drive us forwards, and also, as I mentioned, ikigai, the sort of looking for and promoting those things in our life that we love and that we're good at. So that was a little bit of a mishmash, but it was just the odds and ends that wouldn't fit in the other packages. So, but that's, once again, that's at least that's out of the way, so we can be a little bit more specific and focused from here on.